So I would like to ask you a few questions. So could you tell us about diabetic neuropathy?
Right. See, this is a common question, right? We see a lot of patients with neuropathy and a lot of patients with diabetes. So we do see a lot of diabetic neuropathies. So let's start with understanding what we mean when we say neuropathy or a nerve, right? Many people confuse the veins and arteries with the nerve, right? So first of all, they are different structures. Now, a nerve is also a long wire-like thing. Okay, so it sometimes it lies next to the artery and the vein, but they are different structures. They are part of the nervous system. So we have the central nervous system, meaning the brain and the spinal cord, and the brain and spinal cord is basically controlling the rest of the body. And this control is exerted through information which is spreading to the rest of the body through these wire-like structures, which we call the nerves. Right. So that's the basic, very brief anatomical class on this topic, because it's important to understand that when we say nerve, what we are actually referring to. So any disease of these nerves, these structures, which are connecting between the spinal cord and say a muscle or another the skin. These are the nerves, right? So neuropathy means some disease affecting these nerves.
It's a good point that you said, sir,
Yeah.
because many patients confuse between vein and nerve.
Yeah.
They call the vein also nerve.
Yeah, exactly. And many people land up with us saying they have this visible big varicose veins, thinking that they are the nerves.
Yes.
In fact, in my language, nerves are called naralu. So, so it's a common cause for confusion. So that aside, now let's come to diabetic neuropathy. Now, diabetes is being a fairly common condition. The basic thing which happens in diabetes, the basic underlying pathology, is that it affects the blood vessels, right? And that, of course, there are a lot of details, but to be very brief, it affects the blood circulation to each and every organ, right? So the most vulnerable is the brain, the heart, kidney, the eye, but also the nerves, the peripheral nerves are also vulnerable. So it affects the nerves in that way, causing what we call diabetic neuropathy.
Okay, sir. So could you tell us about the different types of diabetic neuropathy?
Let's see, first of all, the thing is, it affects all nerves, irrespective of which part. So it also affects the nerves to the heart, to the intestine also, so which are not even within our voluntary control. Right? But the most common patterns are the nerves which control the sensations to the different parts of the body, right? So basically, there are two kinds of nerves. One kind of nerve which is sending information to a body, to an organ, and that is from the brain to that organ. That is you can call that the motor nerve, and the other which is sending information back to the brain is we can call it that the sensory nerve. So diabetes affects both of these kind of nerves, and especially in the limbs. Okay, so there is something called symmetric polyneuropathy, which affects all the nerves in different parts of the body. But diabetes also causes affliction of the parts of the nervous system, the peripheral nervous system, which is closer to the spinal cord, the roots of the nerves, or where they are together. It's called the plexus. So it can cause a plexopathy, it can cause a nerve root pathology, and the peripheral neuropathy. It can also cause something we call entrapment neuropathy, which means that the nerve is entrapped in some structure. The most common of this, everybody must have heard, that's why I'm bringing up the topic, is a carpal tunnel syndrome. Many people actually come to us for the first time with some symptom which suggests that they have the nerve is in the hand is affected, which we call the carpal tunnel syndrome. They don't know that they have diabetes. Seeing this, we suspect and we many times we diagnose. So neuropathy can be the first time that you detect that you have diabetes.
Okay, sir. Sir, another question is, does pre-diabetic state also cause diabetic neuropathy, or like
Yeah,
a very controlled diabetic state?
yeah. This is a very good question, because many times I have seen patients whose HbA1c is below 6. They have seen a doctor who said, okay, you have diabetes or you might be getting diabetes and things like that, but they already have the symptoms of neuropathy. And then they worry, okay, how can it be because of diabetes? Because I haven't even been diagnosed, or I don't. Many people even deny it, and they say, okay, it was normal, borderline. Now it has become normal because of their dietary, restrictions. So you say, I'm not diabetic. The point is, first of all, diabetes is like you, whether you have the genes for the diabetic condition, right? So when you have that, then you will develop all the features like you will get HbA1c level beyond a certain point, right? So when a doctor says that you have this condition, basically it means that you have the genetic tendency. And once you have it, that means that with increasing weight, excessive calorie intake, sometimes your diabetes would be out of control. And with dietary control, you would be easily well controlled, right? So in this situation, sometimes we use the term pre-diabetes, meaning that you're not overtly diabetic. And with good restriction, good exercise, and lifestyle change, you are able to control within that. Right? In this situation, also now can be affected.
Okay, sir. All right. So, just a couple of more questions, sir. What are the complications of diabetic neuropathy?
Okay. See, the most common problem which happens with diabetic neuropathy is intense pain. And I've seen people with intolerable kind of pain, burning pain especially, and spontaneously happening. Right? They may not have done anything exerted or in any way, and just sitting, and then they keep having burning. Or sometimes it's just different kinds of sensory symptoms, like there is a kind of feeling as if something is moving, something is rubbing, or something is burning. These kind of pains are the most common symptoms.
Symptoms.
But an important thing is that in the legs especially, okay, because diabetes affects both the blood circulation to both the nerves and to the blood vessels, right? So the blood vessel itself is also affected.
Right.
So these two come together, especially with long-term diabetes, long-term uncontrolled diabetes. People tend to have both these together. So they have decreased circulation and then lack of nervous, supply.
Yes.
So they cannot appreciate pain. So they can have injuries. They may not even realize they have the injury. They don't attend to it, and then it leads to some infections. And then because the blood circulation is not good, the healing is not happening. So diabetic foot is basically this is the underlying factor. So one of the complications of diabetic neuropathy is to develop those kind of
Okay,
symptoms.
sir. All right. One last question, sir. Is diabetic neuropathy reversible?
Yeah, now another $1 billion question that everybody wishes. Unfortunately, after a certain point, it's not possible to reverse. Given current knowledge, there is an area of intense research. A lot of things are used, right? But nothing has shown to be better than good diabetes control, which basically means you're trying to prevent the problem. So once a certain extent of neuropathy has happened, it's unlikely to get reversed. But people have reported some benefit by using different vitamins, okay, and vitamin like other medicines. But more than that, it's change in lifestyle, taking adequate dietary control, preventing diabetic complications is the one sure way of not having them.
Okay, sir.
Okay.
Thank you, sir.